as we begin to plan for the recovery, we need to plan for an equity-first economic recovery here in Washtenaw County to ensure that everyone benefits as we find our way out of this crisis. You see, COVID-19 is not only disrupting our healthcare, our education, and our economy. It is also serving as a magnifying glass, magnifying the existing inequalities we have in our society. For example, in the sphere of public health, here in Washtenaw County, African Americans make up 12.3% of the population, but they make up 43% of the COVID-19 hospitalizations. At a national level, what we see is that African Americans and people of color are least likely to be able to choose work from home situations. They're the ones most likely to be faced with a choice: either expose yourself to coronavirus or go without a paycheck. As relief efforts have begun to roll out from the federal government, what we're finding is that Black-owned and community of color-owned businesses are less able to access that funding. All of these inequalities are not new in our society, but COVID-19 is magnifying them and magnifying their impact. This is a problem that affects us all. When some of our community is getting drowned by these problems, it will affect all of us. For example, if your biggest concern is just to get our economy back online again, what we see is that communities and countries with greater levels of inequality have less economic growth. Economic inequality hurts economic growth. So that's one example of how we all have a stake in an equity-first economic recovery and why we need to plan now. My proposal is that we convene an action team and use the 3 R's of the New Deal as the framework for that action team. How do we provide immediate relief? How do we set up a long-term recovery? And what are the reforms we need even beyond the recovery phase? This framework gives us short, medium, and long-term actions that will help set us up for success. To solve this problem, we need all hands on deck. This is not a problem that any single sector can solve on its own. We need business, we need government, we need nonprofits, we need our financial institutions. We also need the voices of those most affected: business owners of color, businesses that are in low economic opportunity zip codes, and businesses that have significant numbers of vulnerable populations in their employment. Finally, we need a bias for action. Look, I've worked in government. I know how long many government processes take place. We don't have time for that. We're not going to get everything right, but we need to focus on action. When we do that, we can come out stronger with smart policy. For example, the Social Security program that came out of the Great Depression has been one of the greatest anti-poverty programs the United States has ever seen. When it was founded, senior poverty was around 50%. As of 2018, it was down below 10%. Social Security works, and we built it at a time of crisis. We can do that again. And we can do better, because there were problems with Social Security. Social Security excluded farm workers and domestic workers, 2 parts of the economy that are most represented by workers of color. So while a lot of people have benefited from this, the people who've been excluded from the Social Security system are predominantly people of color. As we plan an equity-first recovery, we can do better. Here in Washtenaw County, we've already had an early win on using this equity lens in our recovery efforts. As the review team for the Washtenaw Small Business Emergency Relief Fund planned their efforts, they used the Washtenaw County Opportunity Index to make sure that the zip codes that have been left out of a lot of the prosperity we've seen in this county are not left out of the recovery efforts and the relief efforts. It's this kind of thinking we need to institutionalize across our recovery and relief plan. A lot of people have asked me, what will this look like? What projects will come out of such an action group? Well, the action team needs to be the one to define those, but here are a couple of examples of what might come out. As the stay home, stay safe orders lift and businesses start to reopen, they will need personal protective equipment. If you are a large, well-resourced institution, you have access to PPE, you're more likely to have access to personal protective equipment in sufficient quantities and at a reasonable price. If you're a small shop, you might not. And that's where group purchasing and coordinated efforts could make sure that everybody has reasonable access to personal protective equipment so that they can reopen. It might mean creating intentional access networks between businesses across the county, especially those that are underserved by financial institutions, making sure they have strong relationships with financial institutions so there's another round of stimulus and relief. They're in line for it and they're not excluded from that process, as happened to so many businesses in the first round. Another example is it might mean building on efforts like those of Michigan Women Forward to provide micro-lending and technical support to businesses that have not been well served by existing traditional financial institutions. Where do we go from here? First, we need to build buy-in from key stakeholders, including those frontline stakeholders most affected by the COVID-19 economic crisis. Second, we need to convene that action team so we have the right people around the table that can give us the necessary perspective and can take action. Third, we need to do a quick and dirty process to gather data on what the needs of those frontline businesses and workers are, what are the existing community assets we can deploy to serve those needs, and to get a layout of who are the affected communities so that when we're doing our outreach and engagement, we have the names, the addresses, the contact information to build that list. Finally, we'll need to triage and act on the highest impact opportunities. I'm sure there'll be a lot of ideas that come forth, but in this process, we need to pick the few things that we can get going on and will have the disproportionate impact and execute on those viciously. We have a choice. You have a choice. Either we can ignore equity in the recovery, and what we will see is that those who have are the ones who get. Some will benefit from recovery efforts, many will be left behind. That will further exacerbate inequalities in our community. We will see increased strain on our healthcare system, our educational system, our public safety system. We'll see what little trust there is on those with those communities. It'll evaporate even more, and that will hamstring our economic development and our economic recovery efforts. Or we can be bold, we can be courageous, and we can create an equity-first recovery. We can put first those who have been hurt the worst. We can ensure equitable access to COVID-19 recovery efforts. This will not only reduce social inequality, it'll not only ease the burden on our schools, hospitals, and frontline public safety workers. It'll also build public trust. It'll ensure a stronger economic development and economic recovery plan that works for everyone. Are you on board? If so, please reach out to me as I'm trying to gather ideas, input, and above all, that action team of community leaders that we can use to create an equity-first recovery plan for Washtenaw County.